My research background has focused on the psychosocial aspects of HIV/AIDS, and since my dissertation work, I've really looked at a variety of different topic areas related to that, looking at the relationship between childhood sexual abuse and intimate partner violence on HIV risk behaviors. Completed 2 studies back in Washington prior to moving here, one on helping individuals who are HIV positive with a history of substance abuse engage and stay in care, and a second study working with HIV positive men to facilitate disclosure to sexual partners. Since my arrival here at the School of Nursing at Duke, I've had the fortune of collaborating with one of my colleagues, Julie Barroso, and we're currently working on a project to increase facilitating disclosure among HIV positive women in the context of HIV-related stigma. That project builds upon Julie's work with her metasynthesis work around stigma, and this is an intervention study using the vignettes and the DVD and a new technology-based intervention to try to facilitate disclosure and coping and adaptation for women who are living with HIV and AIDS. When I first became a nurse in 1988, I lived in Washington, D.C., which continues to have the highest rates of HIV and AIDS in the United States. And at that point in time, I worked in an ICU, and many individuals who were in the ICU were dying from AIDS, and many were young people. And that really led to my interest and clinical background in that area. But when I decided to do my doctoral studies to focus on HIV prevention, and through the course of my doctoral studies, I also did an HIV/AIDS clinical nurse specialist program. Over the last few years, I've had the fortune, as the United States has facilitated kind of global access to antiretroviral therapies, to work in sub-Saharan Africa. And for the last 4 years or so, have collaborated with a group of colleagues at my former institution and have worked extensively in sub-Saharan Africa with individuals from South Africa, Lesotho, Swaziland, Botswana, Malawi, and Zimbabwe. And in partnership with those colleagues, we've also looked at the impact of HIV/AIDS on loss and grief symptoms related to nurses. We've also looked at the ethical decision-making that nursing students have, both in the United States and in South Africa, on their beliefs, values, and attitudes about caring for people with HIV/AIDS and their general beliefs about the virus and the epidemic in itself.